All right, everyone, welcome this evening. My name is Dr. Stacy Hellweger, and I have a fantastic guest for you all tonight. You are going to be so excited to hear what he has to say and what he's going to be sharing with you all tonight, screen sharing. So make sure you get your notepads out, get your pens, pencils, all the things. So I want to share our disclaimer real quickly, and then I will read his bio, let you know the format for tonight. So first of all, Lifewave, the information we're sharing tonight is for informational purposes only. If you have any questions, please check with your doctor, your healthcare provider. Dr. Scheiner and myself are not your doctors, but we're going to be sharing information with you that you definitely want to be informed on. So please know that we're not intending to treat or cure or diagnose anything that is going on with you, as always. And then, of course, his bio. You guys are going to want to hear this. Are you ready? So Dr. Adam Scheiner, listen to this. World-renowned laser, eyelid, and facial plastic surgeon. He has been featured in Health Expert, on Dr. Oz, the Doctor's TV show, Howard Stern, the New York Post, as well as on local and national affiliates of Fox, CBS, ABC, and NBC. Dr. Scheiner has perfected a treatment for festoons, one of the most pervasive and often incorrectly treated form of eyelid bags. Dr. Scheiner treats patients from around the globe with his Reset festoon laser treatment. Dr. Scheiner received his medical degree from the University of Pennsylvania and completed his internship at St. Barnabas. Is that correct?
Barnabas, yeah.
Barnabas Medical Center. He's completed his ophthalmology residency at the University of Pennsylvania Eye Institute. He has continued his studies in oculoplastic and laser facial aesthetic surgery fellowship with Dr. Sterling Baker, the pioneer of laser surgery fellowship with Dr. Sterling. I'm reading this. He often lectures to other doctors and contributes to books and periodicals about his techniques. He is a trainer for 2 companies which teach medical professionals about Botox and fillers, and also the trainer for a laser company where he teaches doctors about laser skin resurfacing. In his spare time, he serves on the board and directors for the Spring of Tampa, an organization that is established to help eliminate domestic violence in the Tampa area. Woo, Dr. Scheiner, thank you so much for being here. I am so grateful for you. Take it away.
My pleasure. Thank you so much, Stacy. Okay, I'm going to share my screen here. Start with this presentation first, and we'll hit play. Okay, so you're all seeing my screen? Okay, awesome.
Yes.
Let's see, resume share. Hold on. Okay, let me see. So if I can go through this, hold on. Little technical thing here, hold on. Oh, there we go. Okay, great. So I think it's always good to know the background of the person speaking to you. I come from the Northeast originally. I went to college at Rutgers in New Jersey. I went to medical school at the University of Pennsylvania. I did my residency there. I did a fellowship in eyelid and facial plastics in Oklahoma City, and I've been in private practice now the last 24 years. I'm very fortunate. I have this book that's on Amazon called The True Definition of Beauty. It talks about the way the human brain processes the face. It's actually a Wall Street Journal bestseller. And I speak internationally and I train internationally, and I have a really worldwide practice. We'll talk about that in a moment here. So this is my practice. I have people that come from around the globe to see me. I'm really fortunate to be a resource for people that way. And let me show you a little bit of about this, why this happened.
You know, Dr. Joe's done several stories about people from the Bay Area who go overseas for surgery. They find it to be cheaper. Now we're seeing the reverse. People coming from other countries here to the Bay Area for medical procedures. Why they're doing it? Coming up.
Or would you travel for the best health care in the world at the best price? But Dr. Joe has shown us how patients from the Tampa Bay area have been going to other countries for low-cost procedures. And many of those connections are made on the internet. But she has also found the opposite is happening as well. It's a kind of reverse medical tourism. Dr. Joe tonight's going to show you how hospitals here in the Bay Area are now attracting patients from many parts of the world.
While big facilities like the Mayo Clinic and Johns Hopkins have an international edge, niche surgeons in our own backyard are attracting patients from as far away as Singapore.
I've got some fat deposits kind of on my cheekbone here.
Look over this way.
At 31, Emma Claxton's tired of looking tired.
And I'm sick of people saying to me, you should get some sleep. I just like to have a day where that goes by and people don't say that to me. And I don't look in the mirror and go, why have I got these eye bags?
Her online search led her 30 flight hours away to Dr. Adam Scheiner.
The shadow that's coming down here that we would call this festoon.
Dr. Scheiner's international reach began accidentally.
In my case, I wrote a book chapter about this idea of festoons, and the people who were editing the book, they said, would you put together a video for us? And I put it onto YouTube for the editors to see. And within a day, it was all over the internet.
Now, 80% of his patients travel here for medical care. The doctor's office handpicks lodging, in this case, Tampa's Sailport Suites.
I thought I was going to start with something with one room a month, and here we are.
Christina Overstreet arranges accommodations. Thanks to visiting patients, she's booked an extra 350 nights a year. She's now seeking to partner with other doctors. We met up with Emma there 10 days after her procedure.
Very happy with the condition of the skin. Still a bit sore and a bit swollen, but considering it's only 10 days after the operation, it's been very, very fast recovery.
Minus her festoons, Emma's going back home after tasting Tampa's culinary treats.
I went to Burn Steakhouse, which was fabulous. I went to the Bahama Breeze over there and went to an IHOP because I never had pancakes for breakfast.
I just heard that you're having trouble seeing the video there. Okay.
Yes, we're not seeing it. It's not showing it. Maybe, did you hit play on the?
I'm hitting resume share. Your screen is, let me stop share. Let me try this again. Hold on a second here.
So I can see it.
For some reason, let me try share screen again. And let's go to here, share. Okay, that's share. You can see that, right?
Yes, now we can see the video.
Okay, I'm going to move on here. Hold on a second. It says resume share. The screen sharing is paused. Okay, you can see this screen now?
Yeah.
Okay, let me move on. So this is, I have this book, The True Definition of Beauty. It's about how the human brain evaluates the face. I think you'll find this really interesting. And you can see this screen as well?
Yes.
Okay,
no,
great.
All we can see is just the video of the lady. Just the lady.
Okay, there's something kind of strange happening here. Hold on.
Okay.
Okay, let me see if you can see it this way. Can you see the screen here that as I'm going through the slides here?
No. It popped back off of the share.
Okay, hold on. Sorry about that.
It's okay. It's all good.
Technical, huh?
I know.
Let's go here. Okay, share. Okay, now I'm sharing the screen. You can see this screen now, right?
Correct. Definition, true definition of beauty. How does the human brain evaluate face?
And you see this video
Yep.
here? Okay.
Yep.
Let's just work it this way, I guess, right now, because for some reason, I don't know when I was doing the show, it wasn't really working. So, okay. So to start here, so I have this book on Amazon called The True Definition of Beauty, and I talk about how the human brain processes face. I think you find this interesting. So there was actually a paper put out by a colleague of mine named Jejmet Khan talking about aesthetic surgery, diagnosing and healing the miscues of human facial expression. And in this, he was talking about the face as an organ for communication, and we actually interpret facial messages sort of automatically or innately. And sometimes when we're born, or sometimes with age, our face can change in ways and create messages that are not consistent with the way that we want to send. And most of surgery is not necessarily about vanity, facial surgery. It's really about realigning these messages to be consistent with the way that we want our messages to be sent. There's actually a book put out by a professor, Nancy Etkoff. She's at Harvard. She wrote this book called Survival of the Prettiest. And she looked at really the science of beauty in society. And in this book, she knows that Aristotle was actually looking at beauty back then. He said no one who is not blind could ask that question. And then according to Dr. Etkoff, when we routinely evaluate the people that we see, and when they look at a nursery, the cuter babies actually get picked up first. And I think it's interesting. We do tend if we find someone attractive, we want to please them without really expectation of immediate reward or reciprocal gestures. So what are the characteristics of an attractive human face? Is it the eye of the beholder? We've often heard that. That is part of it, but I want to take you to another idea of beauty, which is mathematical beauty. So I want to take you back to the 1200s in Pisa, Italy. Italy wasn't really Italy then, it was these city-states. In Pisa, there was a person there named Leonardo Fibonacci. He grew up in an upper middle class family, and he went over to India and to Asia and brought back mathematical concepts and put in this book called Liber Bacci. And he was actually looking at the multiplication of rabbits, and he came up with the sequence. This is a picture of me in Pisa. We were very excited to make a visit there. My wife was really excited about seeing the Leaning Tower. I was very excited because there was a statue of Leonardo over there. So the sequence goes as such. You take the first number of the sequence, you add to the next number of the sequence, and that gives you the next number in the sequence. So 1 + 1 = 2, 2 + 2 = 3, 2 + 3 = 5, 3 + 5 = 8, and so on. When you divide these ratios by one another, it comes up with this ratio of 1 to 1.618. And what they found is that in nature, a lot of things had this ratio of 1 to 1.618. And when they looked at the internal parts of a flower to the external parts of the flower, it actually had this ratio of a 1 to 1.618. And you can define curves according to numerical sequences, and that's the curve you see in red there. And that curve actually match the curve of the nautilus or the curve of the helix of the ear. So they thought this was a divinely inspired ratio back then. And they did a lot of, let's see, I have to click through this. Okay, sorry.
That's okay.
There we go. They actually, this will work. Okay, great. They actually did this a lot of work in the Renaissance. So when they drew Mona Lisa's face, she has a lot of these ratios in it. Same with the Parthenon, Notre Dame, and even the Last Supper had a lot of these ratios. And we can actually analyze faces this way too. It's very interesting. And we found that regardless of ethnicity, the more a face had in balance with these ratios, the more attractive we tended to view those faces. Well, that's mathematics. There is this subjective side of beauty too, and that really has to do very much with the media. We're actually influenced by the media. The media has this roving eye and kind of shows us and influences our idea of beauty. So if you look at Julia Roberts here, she has a lot of the classic features of female beauty. She has a large, smooth forehead going down to a smaller nose. Because her nose is smaller, her eyes seem farther apart. She has a gull-wing shape to her brow. She has a more tapered jawline. If you look at Brad Pitt, he does not have a gull-wing shape to his brow. It's more straight across. His nose is bigger, so his eyes seem close together. He has a more square jaw from buildup of these muscles called masticatory muscles. And if we look, now it's too bad they're not together anymore, but I still like it for the evaluation. So we have Brad Pitt and Angelina Jolie. So Angelina has the arched brow, right? And Brad Pitt is more straight across. Her nose is smaller. Her eyes seem farther apart. His nose is bigger. His eyes seem closer together. She has a more tapered jaw and he has a more square jaw. This was actually a study done, and I'm going to ask you, you can even tell me in the chat, when you look at these two photos, which photo looks like the man and which one looks like the woman? The one on the left looks like the what?
This one.
The one on the left, you see. You can even say, Stacy, which one looks like the man and which one looks like the woman?
Well, the man looks like the one on the right.
Exactly, right? And you didn't have to think about that, right? Your brain just told you instantly. And this is what I'm trying to uncover. There's this subconscious language that goes on, and that was your subconscious brain seeing that and influencing your conscious brain. And that's how that came out. Turns out it's a picture of the same person. And what they did is they digitally darkened the eye region and mouth region on the photo on the left. And that is part of what we determine as femininity. Women have more vascularity to their lip region and eye region as compared to men. We have more of one color. They have a little more contrast to their faces. And that is what the subconscious brain evaluates as femininity. Women take advantage of this and they'll wear, eyeshadow and they'll wear lipstick because they know that increases femininity as well, but it's all scientifically based. So we do tend to look at the eyes first. We kind of look at the eyes and mouth first when we're evaluating a face. And this, I actually heard a study by this surgeon. His name is Daniel Alam. He worked at the Cleveland Clinic. He was one of the first surgeons to do a face transplant. It was on this woman, Connie Culp. Connie was married. Her estranged husband actually assaulted her and shot her in the face with a shotgun. And she required like 19 surgeries, but her face was still irregular. And he was talking about the fact that she was the first candidate for the face transplant. And he was saying in the transplants, the most important parts to rejuvenate are the eyes and mouth. That's really what we concentrate on when we're seeing one another. So if you look at our former president here, Barack Obama, we take that part of his face out, we put on someone else. Can you still see, to a certain degree, our former president there? Is that interesting? And do you know who's underneath there? That's Brad Pitt, yeah. So that's the most important parts of our face for what we do. And I think about that all the time. Jamie Lee Curtis had this quote, she's an actress, said, the first thing I look at in a woman is her soul, and then I check her eyebrows. So this patient came to me, she said that people thought she was very stern, and I did a procedure to help raise the brows, and you can see how that she looks more approachable. And if you look back at that curve of Fibonacci, that part of the curve we just restored, that is why we tend to like that sort of shape a little bit better. That's part of what I'm trying to show you here. So we are very social beings, and we constantly evaluate each other's for communication cues, and our faces are a big factor in nonverbal communication with others. When we speak, it's estimated that 7% is the words that I'm using, 38% is my verbal tone, and 55% is these nonverbal cues. It's facial expressions, body cues, and such. And when we see each other, we kind of look at the eyes and mouth first, then we look at the skin and facial contour second. And our subconscious brain then tells our conscious brain, how do we feel about what we saw in those areas? You know, aging changes around the eyes and mouth can convey an impression of being tired, sick, and less vibrant. And improvements that we can make to the eyelid and mouth region have very positive effects on the way that others perceive us. Simple changes, wearing makeup around the eyes and lips, wearing glasses that are flattering, all take advantage of these two powerful areas for nonverbal communication. With age, though, sometimes makeup and glasses aren't enough, and that's why people will sometimes come to me for help with my expertise. There's actually been research done in this, and there's lawsuits about appearance-based discrimination and how it helps and hurts careers. And they actually did research at the Federal Reserve Banks of St. Louis. I thought they did monetary policy, but they were actually doing research there also on appearance and wages. And they evaluated a study, and they found that people with a below average appearance compared to an average person earns about 9% less than with an above average appearance, about 5% more, about 14% swing between these areas. It's something I think that we feel we know intuitively, but there's actually science behind this. So this was a study actually done in Germany. They actually had faces and they changed them each way to be more close to these facial ratios. And if you look at those, and you know, if I was playing this, it would show better, but most people tend to look at 5 and 6 as the most attractive. And this is not your brain having to think through this. This is your subconscious brain seeing those ratios, and that's why we tend to evaluate like these photos best. The next thing I want to really switch to here is understanding our skin. The skin is really our biggest organ. We think about sometimes our liver being an organ, the lung is an organ. Our skin is our largest organ. Its job is really protection. It protects us from infection, temperature. It's a fluid barrier. It's our biggest organ for sensory input, and it makes vitamin D in the sunshine. In the skin, there's two main layers. There's this layer called the epidermis and the dermis. The epidermis has a living lower layer, and then the layers above it are not living. So that purple layer is actually called the basal cell layer of the epidermis. It makes the copies above it. So if that cell is healthy, all the cells above it are healthy. If that cell is not healthy, the cells above it are not healthy. And then we have the dermis below that where there's elastic and collagen fibers. Our skin ages because of the passage of time and sun exposure. Intrinsic aging is really that passage of time or genetics, but premature aging, the main thing is photoaging or exposure to the sun. And sun protection is the best way that we can protect ourselves from wrinkles, age spots, and skin discoloration. In this graphic I'm showing you, the UVA ray is actually a long wavelength. So when we are out in the sun, there's this visible wavelength so we can see each other, and there are these invisible rays called ultraviolet rays. UV rays are some of these ultraviolet rays. UVA is a long wavelength. It's A for aging. It actually penetrates very deep in the skin. It's that bluish color there. It goes through the epidermis into the dermis where it fractures collagen and fiber, elastin fibers, allowing the skin to sag and droop. It's present all day long, sun up to sundown. It will even penetrate clouds and car windows. You think you're safe in the car. UVA can actually make it through the car window as well. UVB creates sunburn, B for burn, most prevalent from about 10 a.m. to about 2 p.m. That's that yellow color there, and it's just into the epidermis a little bit. And UVC is toxic light. Most of it is absorbed by the ozone, thankfully. The SPF is regulated by the FDA. It only applies to protection from UVB, but now we do have consumer measurement for UVA protection. We're looking at something that's broad spectrum and water resistant, and so you have to cover both UVA and UVB to be safe. And incidental exposure matters. So if we wear sun protection every day, that actually really helps protect us. This is a migrant worker. She worked in the sun, and she looks maybe like she's 90. She was 58 years old. And this gentleman was a Tibetan monk, and he was 78 years old. And his skin looks better than some 40-year-olds. The story I heard about this woman, she actually worked in a corporate environment. She rose to the rank of her company. She got a corner office, and the sun would warm her cheek every day. And you can see the difference between the two sides. Now, the one ray that makes it through the window, right? UVA, this is UVA damage over time. This is actually an Australian truck driver, same thing. UVA would come through and hit one side of his face more. You can see the differences. It's kind of striking between the two sides of his face. I digitally kind of split the face and showed you the difference of what would happen if he had both sides really away from the sun. So, okay, we have damage. How do we fix this damage? And it turns out that using lasers, I can remove damaged skin and let the skin to grow back as a younger, healthier, tighter state. And so I call it reset skin for skin damage. We can have skin lesions. So when the sun comes down, it's the UV rays will actually bind together parts of our DNA in something called thymine dimers. And it makes these cells irregular. And that can lead to basal cell carcinomas, actinic keratoses, which 10% of those actually go on to form squamous cell carcinomas. This is a patient actually I did surgery on. This interesting case to talk about. We did surgery to raise her upper lids, and then I worked on her lower lids, and I did some laser resurfacing on her lower lid skin. So it looks a little bit cleaner. You can see it's a little more clear there. She came back to me 2 years later, and she was erupting in skin lesions everywhere except for the place I treated 2 years later. You can see it there. And that was striking to me. I thought, okay, not only did I make her skin healthier, I actually made, or look better, I actually made it healthier. So that really opened the door now for me to use this to make the skin healthier. So now I'm doing this to help people with skin cancers at the same time. So I've done a lot of TV and media relations. I'll show you some. So I was on Dr. Oz talking about this festoon technique, and these are the festoons. They form on the cheek region. Those swollen mounds on the cheek have been difficult for surgeons to fix, and using these lasers, I've come up with techniques to actually be able to tighten these. And let me see if we can actually watch this. See if you can hear this. You let me know.
One of my favorite
Can you hear that?
problem-solving shows, because it helps you look younger and feel better about yourself. So today, we've got the biggest breakthroughs, the most astonishing advances, the ultimate fixes for your most hated age-related problems. And the first fix is for the problem that all of us will face as we age, eye bags. But now, there's a cutting-edge procedure that banishes bags in no time, and the results will leave you speechless.
My name is Dr. Adam Scheiner. I specialize in eyelid and facial plastic surgery. Okay, got that films there. Donnie?
Laser eyelid and facial plastic surgeon, Dr. Adam Scheiner, is here. Adam, welcome to the show.
Well, thank you so much. We're going to start here. You see this green color of the avocado, and we're going to compare that to the top layer of the skin. This is the first layer that goes there.
Please join us. Come on out. That is spectacular. Spectacular. Congratulations.
It's great to see you.
Come out of seat. Dr. Scheiner, congratulations. Wonderful work.
That kind of launched my practice. I didn't really realize that treating festoons was a rare thing. And I wrote a book chapter for a colleague of mine. And then he put it in this book, and everyone saw this. And then Dr. Oz, we got in touch with him. He wanted me on the show, and then the whole world heard about me. So it's very exciting. Actually, I went on the doctors as well for the same thing. This was about a year later, and I was talking with Dr. Orden about this, and this was the woman, Erin, who had pretty bad festoons, and this was the same thing that we helped. Okay, I want to talk now a little bit about my normal process, because we're going to wrap around now how X39 kind of helped me, okay? So these are patient before and afters. It uses this proprietary healing protocol that I use. So we can go from the left to the right, okay, with this laser technique, with this reset skin technique. And some people say that doesn't even look real, but that is real. That's what we can do when we get the skin healthier. And so not only did we make it look better, her skin is about 95% healthier. We get rid of skin cancers with this at the same time. This is a gentleman, the same thing, that kind of swelling, the swelling he has on the lid. You see how much tighter the skin looks there. We do it for men too. And we think that this is kind of funny because it looks like his younger brother, looks like the older brother and younger brother. Same thing here. The depth of this damage, people say, well, is there a cream that does that? But if we can remove the damage and let the skin grow back naturally, we can have new collagen take place there. And the same thing here. She was actually sent to me by her dermatologist because of the skin cancers that she was dealing with. And you can see how much healthier her skin looks after this. Okay, so I've been doing research over the years. I've been practicing now 24 years on how to heal my patients faster from my treatments, because there's a healing process. We don't do this procedure and they look great the first day. It takes about 10 to 14 days usually for the healing, a couple months for full healing. Okay, when you're getting results like that, you actually have to injure the skin to a certain depth. It has to then grow back, and then the skin has to heal. So I have done research. Years ago, I found that amniotic stem cells injected into the skin actually helped the skin heal faster. That was really striking to me. They're pretty expensive, but people have used that. Hyperbaric oxygen absolutely helps. I put people through a series of we call them dives. We put them in a hyperbaric chamber each day for about 5 to 10 days, and actually helps heal the skin better. Oh, someone's drawing on me? That's interesting. Okay.
No one has access to do anything. That's really weird.
I don't know what just happened there. Okay. And then the last thing is X39 stem cell activity patches. So yeah, I wonder why. Okay. Somehow someone drew on that. That's okay. So now I'm actually using the X39, and this is going to be really interesting. I want to show this to you. So I want to say the same thing. Lifewave, this is a disclaimer. Lifewave does not treat specific diseases. We don't create patch protocols to design to treat any specific condition. This is my experience alone with my patients. I can't say this would hold up for everybody, but I think it's something I'm very excited about. So this is the idea. This is a patient with a patch. Okay, 2 with the patch, 1 without the patch, and this is sort of their before picture. So look at all 3 of those photos. Okay, now we're going to go forward. This is 6 days later. Can you see the difference in the skin in the 2 patients with the patch compared to without the patch? Can you appreciate that?
Mm-hmm.
Yeah, wow. It's really striking.
Dr. Scheiner, go back one more, just in case, so they can see again. So this is a lady without the patch.
On the left.
Yeah, and the center, she's used the patch before surgery, correct?
Correct, and the same with the other one. They've used it about a month before surgery.
Okay, go ahead.
And this is now at 6 days after. I'm used to seeing for 23 years, people looking like that left photo without the patch. That's what all my patients look like, okay? That's a normal picture for 6 days after. It doesn't alarm me. That's what it looks like. Then I started using these patches and the patients are healing dramatically faster. I think that they look like they're maybe day 10 after surgery. Let me move on. See if I can go here. This is 10 days after. And look how amazing the photos are looking here. I think it's Suzette Hierro was drawing on there somehow. Anyway, so X39 patch, this patient here, she looks like she's a month after surgery. This is 10 days. See the redness there? And she's not fully healed yet around the eyes. This is what I'm used to seeing at 10 days. I'm seeing patients come out now looking like they're a month after surgery. And for contrast here, this is that same patient 5 weeks this is this patient on the left, 5 weeks after surgery. So they look at 10 days. Yeah. This patient took 5 weeks to look like. It is blowing my mind. So this is what we're now offering to all our patients.
Oh, wow.
And I have this book now on True Definition of Beauty. It's on Amazon if you're interested in getting it. What I want to do now is I want to talk a little about, now, okay, what is X39? How does this work? So I'm going to stop sharing here. I'm going to share another slide here.
Maybe we can get those little things off there, whatever that was. That was really weird.
I know, it was strange. Okay, let's share here. Hopefully it. Okay.
Hopefully those are gone.
Okay, you ready?
Yes.
Okay. So this is talking about, now some of you may know about this, which is awesome. And if not, I'm going to teach you a little bit more about this. This is this idea of X39 and how does this technology work, okay? There was actually a study done, and these are the authors, Caitlin O'Connor, Mel O'Connor, David Yu, Janice Eickhoff, Susan Wagner, and Amy Chang. And it was published in Internal Medicine in 2021. This was the paper. It was a double-blind testing of the X39 patches to determine, could it raise this molecule called copper peptide. I will tell you, as a surgeon and as a physician, we have known about copper peptide for a long time. Copper peptide is a molecule that happens in the state of injury or trauma. And the reason it happens there, it causes stem cells to come to the area and then go throughout wherever they need to go throughout the body to heal areas of inflammation. There's these things called cytokines. It's almost like a homing beacon. And so if you have a problem in your knee, your neck, when I'm doing this to the face, that's where the cytokines are. And all the stem cells go to that person's face to help heal them. And this was statistically significant. I'll go through this a little bit here. Let's see if I can click here. So it's double-blinded. It was a controlled study, looked at the impact over 1 week and the level of copper peptide in the blood. And it was actually, this was fascinating. It was actually presented to the patent office to receive a patent for this technology. It was so unique. So there were 60 people randomized into 2 groups. They drew blood. They wore it for 7 days. They take more blood at 24 hours and for 7 days, and they saw a significant increase in the copper peptide compared to the group that did not use the patch. So let's just talk about what is copper peptide first. So we'll get back to the study here in a minute. So this was first isolated by Dr. Lauren Picard in 1973. It belongs to this group of emergency response molecules that released when we have injury and comes to a body's aid. And it's naturally sent to injured tissue and shown to have a therapeutic role in age-related neurodegeneration and cognitive decline. And even in diabetics, this is fascinating, it improves axon survival and helps diabetics with diabetic neuropathy. It activates stem cells. I'm showing you in my case, it accelerates the speed of wound healing. It's beneficial for hair, skin, nails. It can tighten loose skin. It can repair a protective body, skin barrier proteins. I'm going to show you some photos here in a little bit. Reduce the depths of wrinkles, smooth, rough skin. It's antioxidant. Don't we all need antioxidants, right? And anti-inflammatory. We're understanding right now how bad inflammation is for our bodies. So here is something that if we can increase copper peptide in our body, we're going to have more antioxidants and less inflammation in the body. How amazing is that? Okay. It's altered by the expression of human genes' neural function. So this is really saying that there's a whole series of genes that sort of set up neuron function. And they're showing that when you increase copper peptide, we can increase the gene expression by 50% to help neuron function. This is really interesting. It induces strong anti-anxiety, anti-aggression, anti-pain, sometimes minutes after in the study of rats. And I will tell with my patients, we've had patients who we've put on this a month before, and they come and they say, you know, I just put this on and I just have a calming effect of myself. And that's because it's instantly affecting the brain to a certain degree. That's why we're seeing that. And this is something we never want to have, this thing called intracerebral hemorrhage. This is if you had a bleeding in the brain, what happens is the neurons actually die, do something called apoptosis. That means kind of the death of neuron cells. And if you have high levels of copper peptide, you actually have less damage of the nerves, less of that apoptosis or neuron death, even in the case of intracerebral hemorrhage. It's been implicated in resetting, this is amazing, almost 4,200 genes to a younger, healthier state. Just think about that. If you could reset your genes to a younger state just by wearing, let's not even talk about when I'm talking about X39, we're just talking about copper peptide first. If somehow we could increase copper peptide, and then reset 4,200 genes. And it's the #1 bioactive compound actually in the treatment of lung disease, chronic obstructive pulmonary disease. Amazing. They're actually already using this in therapy. And this is interesting. So when we have cancer cells, okay, we might have a cell in the middle and there's a cell in front of me, to the right of me, left of me, above me, below me. And normally there are signals from the surrounding cells saying, okay, I'm in the middle, don't divide anymore. What happens in cancer cells is that cancer cell says, you know what, I'm not going to respect any of those guys around me. I'm going to keep multiplying. And it is that multiplication that becomes the problem, because they'll move into areas where they don't belong and then they hurt the normal tissue there. The cells themselves are not always dangerous themselves, it's just where they go into that causes the problems. And so they found that if you can increase copper peptide, you can actually reprogram them to say, okay, instead of replicating, now it's time not to replicate or to die. Okay, we can't make medical claims about this. This is something that we're just seeing in the research. And we're just saying this specifically about copper peptide, okay? And we have never seen any side effects with this, the use of this. We've had people sometimes say that, oh, I have a little headache after. Sometimes we feel that it's actually pushing out toxins to a certain degree. And we might say, okay, instead of wearing for 12 hours, just wear it for an hour at a time. But there's never been any real side effects with the use of these patches or with copper peptide. It's been used, this is fascinating, in humans in the treatment of damaged segments in the neck. They have actually, so we're using copper peptide in the patch just topically. They've actually injected it in and around into the skin around the damaged area of the nerve, and it helps those nerves to reattach to each other. This idea of it, okay, this is a complicated sentence, but enhanced activity of alginate hydrogels for human cord blood, mesenchymal stem cell osteogenesis. So they were trying to get bones to regrow, and they put on a gel, okay, on the bone to see if it grow. And when they put more copper peptide, we saw better healing of those areas. And we see an increased healing of many tissues. I'm showing you already the skin, stomach, intestine lining, bone tissue. It is strongly attracts capillary cells. So the copper peptide might be out there and saying, okay, we want to heal this area. Come on over capillary cells, come over mast cells, come over macrophages. They'll come to the area of the copper peptide and start growing capillaries and infiltrating the area, trying to heal that area. We have a natural gene system for clearing out the cellular debris in our cells. It's called this ubiquitin protease system. And they found that, not even talking about external now, we're talking about copper peptide here, right? Copper peptide, when it's high, activates genes, a downstream activation of this ubiquitin protease system to clear out our cells. Isn't that something we could all use? When we inject cortisone into a wound, it actually suppresses regeneration of that area. But when there's high levels of copper peptide, it blocks that anti-regeneration effect. So you can have the benefits of cortisone without the negative parts of cortisone. And this is fascinating. So there are things that we know that cardiovascular disease is one of the top causes for mortality, okay, in our nation and really around the world. When we have high levels of fibrinogen, that's actually a top predictor for cardiovascular and heart disease. When you have high levels of copper peptide, okay, it actually reduces fibrinogen synthesis. How wonderful is that? And when people have heart failure, it can actually, high levels of copper peptide can increase myostatin gene expression 9-fold. Amazing. In PubMed, okay, you can all go here, look up GHK/CU peptide. There are 43, let's see, there's 13 pages of this. I'm trying to see, it's small here for me. But there, you can go there yourself and you can see the, 124 papers on this specifically. And this is talking just about copper peptide. So we're going to back into this. So if we could find a way to increase copper peptide somehow, this would be amazing, because look at all the amazing effects that copper peptide has on our body. Okay, so you can go on to this site and you'll see all these papers and you can dive into them. It's very interesting. This was one that they actually showed. This was talking about that angiogenesis. Remember, it said that it was actually causing vessels to grow in. This is where it came from. The copper peptide lysosomes were put on a scald wound in mice, and they saw proliferation and angiogenesis under the effects of copper peptide, like I was describing. Let's see here. This was another one looking at, this is Lauren Picard who wrote these initial papers and looking at the protective actions here. And here they talk about, so there's this NF-KB, which is this really bad molecule that has to do with cancer and with aging. And copper peptide will actually suppress that molecule, which is really powerful. So going back to the paper now we talk about how amazing copper peptide is. Okay, so let's see what the results were. So we saw a significant increase in copper peptide in the blood in the active group compared to the control group from day 2 to 7. It almost took a day or so for it to ramp up to see the statistical significance, but that's what we saw here. So when we put it on their skin, you know, our skin is meant to work with light, this whole idea of photobiomodulation. When UVB rays come in, I mentioned that makes the skin red, but will actually be involved in a step to help make vitamin D from the sunlight in our skin. So we can put it really anywhere on the body. It's going to work. The studies were done initially on the back of the neck or underneath the belly button or umbilicus. And this peptide is amazing. So this is what it's showing. It increases skin, it improves skin and hair. So this is not saying specifically that XR9 does this, but copper peptide does this. Copper peptide will actually help with colon cancer and program cell death. And we're talking about that NFKB, which promotes skin cancer growth. It inhibits that, okay? COPD, it actually protects lung cells. Superoxide dismutase, so it's anti-inflammatory, just amazing. And nerve function increases that. We talked about increasing the gene effect, and we talked about the intracerebral hemorrhage as well, and then using it for the neck as well. And so it's amazing how this is working. And they got a patent for this in 2020. So it converts an older liver cells to a younger state. It helps with collagen repair, and it's sort of like fine-tuning our genes, resets our genes back to a younger state. It's applied anywhere on the body, and then there's nothing in the patch. It's actually nanoparticle crystals that take our own infrared energy and reflects it back on itself, that in a frequency that causes an upregulation of copper peptide that recruits stem cells to the area. They then go throughout the body wherever there's an area of inflammation or cytokine activity, and that's where it starts to heal. This was interesting. They actually did a study in Japan looking at people in a very, very dark space, and they found that humans actually glowed. We actually have light coming out of us. We can't see it all the time, but it's really there. So, you know, we are these souls in our body. We put out energy, right? And that's what's going on here. So the benefits, okay? Stem cells, we can elevate stem cells, okay? So there's an immediate effect that people have with antioxidants and decreased inflammation. That's why certain people might feel like a calming soon after they put it on. More energy that people can have, better sleep. People are remembering their dreams a little bit more. We're hearing that. Dramatic pain relief. I'm going to show you something here. So this is really interesting. This idea that can happen within minutes. I have a colleague of mine who's in Philadelphia. He's one of my first mentors in surgery, and we were talking on the phone, and we were talking about ways to heal patients faster from my procedures before I really understood about XR9. We were talking about something called exosomes at the time. And so we actually sent him some patches because he said that he had a wrist problem and he was going to have carpal tunnel syndrome surgery. So I said, his name is Alan. I said, Alan, let me send these patches to you. This might help your wrist. Maybe you don't need surgery. We overnighted it to him. It took him until Wednesday to get it. And he first put the patch on Thursday. He didn't tell me at the time, but he was having serious problems with his back. He had a lot of pain. He had steroid injections in his back, trying to heal his back. And it wasn't working well. So on Thursday, when he woke up, he was texting his doctor, seeing if he could have more steroids injected in the back to heal that area. So he puts the patch on, and you can read it here. It says, you know, he's having a lot of pain here. He said an epidural that failed. He said the patch went around 7:15. It was about 3 hours later. He said he was jumping around the OR. He said the nurses noticed it. Everyone noticed it. He said his back felt 75% better. He says, I don't understand. He says, but I'm never taking this off. And I was like, what? So this was one of our, now we call them these kind of one patch wonders. So not everyone has it happen this way, but this blew my mind. This is a fellow physician who is saying this. Now, I will tell you, he actually told us he's no longer undergoing neurosurgery for his back because his back is doing so much better.
Wow.
Is that an amazing testimonial?
That's huge.
Wrinkle reduction. This is a woman, Maddie, and this was after about 2 years or so on the patch. Look how her skin's getting better. And this will help. If you need more help, I'm here for you guys. But this helps as well. Sports performance. They're noticing people recover better after that. Hair growth. This was fascinating. This was from a woman. She said her dad's hair grew after about 6 weeks of being on the patch, which is something we're seeing too. This is interesting. Skin rejuvenation. This person, this on the right here, he actually fell through rafters and through a ceiling. He broke 6 ribs, punctured a lung. He expected recovery was 6 weeks. He was back at work in 3 weeks because the stem cells have amazing abilities. If we can increase that, it actually can heal skin. Same thing with this fingertip. And this woman actually had radiation treatment. Look how her skin repaired after with X39 and with these patches. Decreased pain and brain inflammation. This is really interesting. These were really complicated sort of slides, but there's sort of hypoactivity and hypoactivity and hyperactivity. We want sort of something in the middle, and that's what this is showing here. We can actually improve brain health. This scar removal. This is interesting. This is a patient who had open heart surgery. This was her scar at about a year later, and then after a month, look at how much collagen filled in the scar. Look how much better that is. There's another case like this. Look at the way you don't have to put it on the wound necessarily. It's going to find where it needs to go. Okay, but if people want to put it on an area, there's no problem with that. It's going to work no matter where we put it. And here, look how her foot actually healed quite well there. Wound healing. This is from a surgical scar. It was 2 weeks. This is inflammation around the sutures. The scar is still there, but you see how much flatter it is because it's anti-inflammatory. And then youth renewal. Okay, and this was okay, and this. Okay, this was actually okay. I'm going to stop there. So this is part of another talk that I gave, but I think so. Did you find this interesting? Let me know in the chat if you found this was interesting about the nonverbal communication. Did you learn something about the skin? The ideas about reset, how we communicate with our bodies, and now about X39. So we know copper peptide creates these amazing results. We know that X39 will increase copper peptide. Ergo, we can make the conclusion that wearing this patch should help these sort of things happen. And we're now seeing it in practice.
Wow. That's incredible. I'm just blown away by how much the time, right? What did you tell me? Like 40% reduction in their recovery time?
40%. And the only things that did this before were stem cells, right? That had, they were expensive. We had stem cells. It was out of a company out of Santa Monica, Sky Orthobiologics, and we injected it into the face. Mm-hmm. And then we have the hyperbaric oxygen, which helps a lot. That helps with swelling, and that's great. Also helps healing. That has a cost too, but this is amazing. So the healing that I'm seeing now I'm giving talks at my meetings. And when I'm at the meetings, I'm actually talking to people about this specifically. So we've actually started colleagues on this now, other physicians I'm starting on this to help them and their patients as well.
Wow. Thank you so much for that. Very in-depth. Like I loved all the slides with the skin and the UV and UVB and A and C rays, all of that, right? To really understand how important your skin is, but also how easily it can become damaged. And then obviously, I love that you shared the alternatives. Surgery, right? Laser, resurfacing, things like that. Those options are out there. But being able to use this patch, as you showed, big, hyperbaric oxygen chamber. I spent 62 dives with my daughter twice a day, every day, 4 months, right? We did that. And that's a lot of time, a commitment. And we did stem cell injections, right? A lot of cost to those types of things, invasive. And to be able to find something like this in your practice to help your patients, not that they don't do those other things, they can definitely do the protocol that you have, but to be able to use something that's as simple as easy, but also causing other effects happening with them.
I had a patient that came in from Michigan recently. She was on it for a month before. She had a problem with a tendonitis where for a year and a half, she couldn't close her hands. She comes in and she's wearing for months. She's like, doctor, look at this. I'm closing my hands. And then she healed fast too. And so it's just amazing. Like I want to heal people quickly from my procedure, but we're hearing all these other sort of effects where joints are getting better and pain is getting better and sleep is getting better.
Wow. And that's what it's about, right? Improving the quality of their life. So Absolutely. They look good and feel good. Wow. Well, thank you, Dr. Scheiner. I'm so grateful you took the time to be on here. And thank you again for your presentation. I know everyone there, you can read in the comments. They're just like, whoa, this is amazing. So thank you so much. If you want to look down through there, if you want to, feel free to comment, respond to any of them. I know we have about 8 minutes left, and I do want to share a couple other things with our viewers tonight. We had 500 people on here, and that's the max on this Zoom. So it maxed that out. So I definitely want to share that and be able to answer their questions. Okay, someone is screen sharing. Hang on one second. Let me.
Oh, that's right. Anyone can. Yeah, you have to change that now.
I'm popping that back off. Yeah. Stop the share. Okay, there we go. Perfect. Get this back up again. Okay. So feel free if you want to answer in there. I want to share with all of you very quickly in the next few minutes. So if you have questions, please feel free to type them in the chat, as always. The promo this week that the company has out, I want to talk to you about that very quickly. I don't know if you saw the email or not, but the promotion that the company announced yesterday is with the first patch that David invented, the second patch that David invented, and also the #2, used to be #1 selling until X39 came out, but the #2 selling patch that we have that David has invented. So I want to real quickly just give you a little rundown of these. When you buy these 3 patches in the pack, you save 20%. And there is a limit to 5 packs. So 5 of these bundles that you can get. The promo started yesterday and it goes until Sunday. So if you use these, for me, these are things in my medicine cabinet that I always have on the go, no matter what. They're in my bag because you never know when you're going to need them, right? We don't use over-the-counter things or stuff like that. And so let me tell you real quick about the first patch. You guys probably know David was working with the SEALs. He was contracted by the U.S. Department of Defense, the government, to help with different types of survival equipment. He was asked to contribute to the SEALs problem of oxygenation, of stamina, endurance, energy without using caffeine, amphetamines, uppers. He was downloaded by the divine, downloaded by God, the idea to create a non-transdermal patch that triggered beta oxidation. Working with the polarity of your body, this dual patch system turns body fat into fuel. And using this patch in 2 places, one on the right, white on the right, tan on the left, where you can do the insides of your wrists, the pericardium area. You can do, stomach 36 down below your knee or inside of your ankles. There are different spots in the instruction booklet. But using this patch, he was able to help the Navy come off of their caffeine, amphetamines, and uppers and use this patch to be able to increase their stamina, endurance, and energy in the field days on end, right? Well, 9/11 happened very quickly. The U.S. Department of Defense pulled out and said, okay, we can't do that. We've got to go protect the country. And so what happened was he started working with Richard Quick, who is a 6-time Olympic coach and worked at the Stanford University swim team. So what happened then, they started doing clinical studies. David said, this was great, but I need proof. So he dove in deep and proved through 2 years of clinical studies that this patch actually did what he said, increased beta oxidation, able to turn that body fat into fuel. So burns an extra 300 to 600 calories, but also gives you endurance and stamina and energy. Using it on the pericardium spots, which is here on the wrist, we can see normalization of the heart rate. So when you look at HRV, being able to bring that heart rate into balance is very important for cardiovascular health. So lots of benefits in the lymphatic system. If you turn over the lymphatic system faster, you get toxins out, right? That's how our body dumps that excess. And so this patch does that. Huge patch you want to keep in your arsenal at all times. The Icewave, second patch that he invented, similar in that it uses a white patch and a tan patch, but this patch, again, working with the polarity of the body, use it on the location of the pain to be able to eliminate the pain on the spot. I want you to go to Lifewave Icewave. I want you to type that in, Lifewave Icewave on YouTube. You will see David has done 5 videos. They're about 4 to 5 minutes each. He talks to you about the placement of Icewave to eliminate pain on the spot. So white on the right, tan on the left. That is the general rule of thumb. But there are other ways you can use it, clockwise method and things like that, to be able to find exactly that pain point and be able to open up those energy channels to eliminate your pain on the spot. So Icewave is always in my bag because you never know. You could trip, you could fall, you could bump your elbow, you know, who knows what could happen. I know when my husband plays golf, 18 holes on the course without a golf cart, he comes home and he wants Icewave on his ankle. And so that's just something you have. You don't need it every day, but it will get rid of the pain and you don't have to take any kind of over-the-counter thing that could be toxic to organs. The last thing I want to mention is Eon. You heard Dr. Scheiner talk about reducing inflammation, and X39 does some of that. It does reduce some inflammation. He talked about elevating your SOD, right, which is the body's own natural anti-inflammatory capabilities. This patch looks the same, right? This signals that peptide in your liver to elevate your own SOD and bring down different inflammatory markers in the body. So he talked about fibrinogen with the heart, direct link to cardiovascular disease. This brings down that inflammatory marker. We also know he mentioned cytokines, bringing down that inflammation in the body. Eon does that. This patch also helps with pain, inflammation, pain. They go hand in hand, right? So we can help to reduce the pain level in the body. You've heard me interview Dr. Nicholas a few weeks ago, the chiropractor of 12 years with Lifewave. He uses this immediately on his patients, even before he goes to Icewave, because of one patch, putting it on the spot, immediately works like this at the speed of light to help reduce inflammation. So many different inflammatory markers this patch reduces, right? Plus, we know that it puts your body in that parasympathetic state, which is that rest, relax, digest. We call it our happy patch, right? Our happy patch. So that's Eon. So basically, if you're just catching on to this, these three patches are on promo. I love that they're almost like red, white, and blue, right? 4th of July, red, white, and blue. It kind of looks white, silver, but this is our 4th of July promo. So these three are 20% off just until Sunday. You go into your back office, and if you're a guest tonight, the person that invited you can help you get set up with an account, and then they can show you how you can get this discount. But for those of you that are currently have an account, go into your back office, click on store, click on promotions, and you will see this promotion. Okay, you will see that and be able to take, like I said, only 5 are allowed. So with that being said, Dr. Scheiner, I want to turn it back over to you and say thank you one more time. If you have anybody has questions, if you didn't get your questions answered, get back with the person that invited you. I know Dr. Scheiner put his website in there, so if you have any questions for him specifically, you can go through there. I know his wife works very closely with him and monitoring and being able to help as well. Do you have any last comments, anything you would like to share, Dr. Scheiner?
I just want to say what a pleasure it was speaking to you and to everyone who I seeing all the comments here, just lovely. And, you know, we are using this in our practice, and thanks for you and everyone for introducing us to this technology, because it's really helping my patients quite a bit. And I'm here to, I can be a resource to you guys. If you have any questions, I'm here for all of you.
Wonderful. Well, thank you so much. Thank you. And you guys know this will be uploaded to my YouTube immediately. And so you will be able to share that out, because I know we maxed out my room at 500. So thank you, Dr. Scheiner. I appreciate you. And you all have a fantastic evening. Thank you, everyone.